Hello, my name is Susmitha Helbling, and I am presenting our SURF poster, Nursing, Risky Business, an examination of suicide rates in nursing. This poster was created by Cassie Drinkall, Aleta Munden, and me, all juniors in the Carroll College Nursing Department. Suicide has been a rising concern within the general population across the globe for the past few years. According to the Centers for Disease Control and Prevention, suicide rates have been increasing, and there are an estimated 800,000 people who take their lives each year. With the rising number in suicides throughout the world, we wanted to research this topic more. And because we are about to begin our future career in nursing, our group wanted to see if working in a healthcare profession, more specifically as a nurse, leads to higher numbers of completed suicides, and if there were any preventative measures or programs in place that are available to nurses to support their mental health. This led us to our question: among employed individuals, how does being employed in a nursing occupation as compared to a non-nursing occupation affect the suicide rate? The goal of this research was to explore and compare the suicide rates of those employed in a nursing occupation to the suicide rates of individuals employed in a non-nursing occupation, in hopes of finding solutions to decrease the prevalence of suicide within the nursing field. This goal was important to our group because we want to be able to implement new occupational health promotional practices and decrease the number of suicides within the nursing occupation. In order to figure out if there was a correlation between suicides within the nursing profession compared to that of other occupations in different fields, 6 articles were analyzed and reviewed. Along with these articles, resources from the Centers for Disease Control and Prevention, the U.S. National Library of Medicine, the National Institute of Mental Health, and the World Health Organization were also used to gather further information. Within our research, articles came from many places across the globe, including Hong Kong, China, Queensland, Australia, Denmark, the US, and other various locations. This helped us to understand the prevalence of nurse suicide being a global problem, not just a national one. Within the 6 articles that were reviewed, the most helpful articles that provided information to our PICO question included the article "A Longitudinal Analysis of Nurse Suicide in the United States with Recommendations for Action" and "Suicidality Among Hong Kong Nurses, Prevalence and Correlates." The article "A Longitudinal Analysis of Nurse Suicides in the United States with Recommendations for Actions" is the first national study on nurse suicides. This information was very important because the study started in 2005 and went through 2016 and was just published in 2020. With this up-to-date information, we were able to really come to an understanding of how much recent and relevant data there is regarding our specific topic. In the second article, "Suicidality Among Hong Kong Nurses, Prevalence and Correlates," research utilized a quantitative cross-sectional survey to explore the prevalence of suicides and factors that play into suicidal ideation for nurses in Hong Kong. This article was one of few articles that actually asked nurses about the factors that influence their suicidal thoughts. To gather information on the factors that could be playing a part in nurse thinking about suicide, participants answered questions from different categories addressing suicidal ideation over the past 12 months, suicidal behavior, family factors, the impact of work-related factors, and substance and alcohol use. The researchers also utilized the Lovibond and Lovibond Depression Anxiety Stress Scale 21 and the Deliberate Self-Harm Survey as well. Through the answers on the surveys that were sent out, the researchers were able to examine the relationship between these factors and how it correlated to nurse suicides. This not only helped to discover that nurses thought twice as much about suicide compared to other fields of work, but it also helped to give an insight on the actual factors that are leading nurses to commit suicide. Through this information, further research could take part to help nurses with identifying habits that could help them manage stressful events and other factors that are leading nurses to think about suicide. In conclusion, these 6 articles that were reviewed provided adequate data to discuss potential suicide trends among multiple occupations. Many of them even provided enough data to insinuate an increased suicidal occurrence among those employed in the nursing field. However, even with this information, these articles lacked the evidence to produce a universal consensus regarding suicide rates among various occupations, resulting in an inconclusive answer to our question on whether or not being employed in a nursing occupation as compared to a non-nursing occupation affect the suicide rate. The inability to produce a generalized understanding of occupational suicide rates is largely due to the different methods of data collection and interpretation practiced in each study. Within each study, there were cultural differences on understanding what suicide is, with each study examining and describing their data on suicide differently. With this being the case, there needs to be a universal study that could gather information in the same way and with the same idea of what suicide is across the globe. The idea is supported by Davidson et al. When they state that information regarding actual nurse suicide is sparse. Additionally, in the article by Anderson et al. Concluded, the present findings point to a need for increased awareness of the risk of suicide in several occupations. Until further studies can take place, the proposed research question cannot be answered with confidence at this time due to the lack and variation of research. Although the answer to our question may currently be inconclusive, we still care a lot about keeping nurses safe and decreasing the amount of suicide within the nursing population and non-nursing populations. Throughout this research process, this topic has become even more substantial and important to our group, and we hope to continue to look for ways to apply what we have learned to our nursing careers. One reason that has motivated us to continue to think of ideas to reduce the amount of nurse suicide is because of the topic of nurse suicide being addressed more frequently in our current world and being able to bring this issue into light. One of the discussions on nurse suicide that made us realize the importance of this project was from a recent article that was published on March 26, 2020 by Fox News. Within this article, it told the story about a nurse in France who tested positive for COVID-19 and unfortunately completed suicide in fear of spreading the virus to people she was caring for. Our group was shocked by this article because this nurse took her life because she thought it would save others. This factor of the thought of having to put patient safety in front of our own was never considered to be a reason why a nurse would commit suicide before we read this article. After reading this article as a group, it gave us even more reasons to address this issue and change the nurse suicide statistics. In addition to resources that were analyzed, our group has worked together to identify reasons why nurses are not getting the help they need in times of crisis. One of the reasons we identified that nurses may be experiencing suicidal ideation and suicide more often is due to the fact that the nursing profession is considered a selfless profession in which we care for those who are sick, but there is no one to care for us, nurses. With this need to provide care to nurses, there are many ideas and steps that we came up with that hospitals and healthcare offices could implement in their facilities in order to ensure their nursing staff is getting the help they need in times of crisis and decrease the rate of suicide in nurses around the world. One of the first things that could help nurses would be to implement programs that watch out for the well-being of nurses' mental health. Davidson et al. States, workplace wellness programs and suicide prevention programs may be an underutilized resource for nurses. With this known fact, hospitals and medical offices should implement mental health screening and counseling opportunities for nurses regularly or in times of crisis. This could include access to monthly counseling sessions for healthcare professionals in high-stress environments such as those working in the ICU, hospice, oncology floor, or psych units. Implementing counseling resources within hospitals for nurses would be something that could really help nurses with their mental health needs, especially because hospitals typically don't have these types of resources available for nurses who need them. This is relevant to Montana because Montana does not have special resources specifically for nurses struggling with their mental health. Another way to implement change would be through administering a PHQ-9 test to every nurse at least once a month. This would be a quick and easy way to screen for any nurses who may be at risk of mental health crisis, and also allow for nurses to realize where their emotional and mental well-being is and reach out for help before things escalate. The last intervention to help all nurses would be to implement a room in which nurses could go after stressful events occur to debrief about what happened and how it impacted them. This could help nurses by giving them the opportunity to let situations go in a healthy way, rather than carrying around all the weight on their shoulders for a long period of time. I hope you enjoyed this presentation, and if you know anyone struggling with depression or suicide ideology, you can reach out to the National Suicide Prevention Lifeline at suicidepreventionlifeline.org or 1-800-273-TALK. Thank you.